Right now on 12 on Health, checking on baby before birth. Key test every mom-to-be needs to know about. Also, new technology to boost your circulation and put your best foot forward. And a local man gives away a kidney out of the goodness of his heart. This is 12 on Health with Gillian Neff.
Hello, everyone. Welcome to this edition of 12 on Health. You're watching News 12 Connecticut, as local news gets. Now, many people with diabetes experience poor circulation and sensitivity in their feet. Now, this can lead to painful ulcers and even amputation. However, there's a new high-tech treatment called MicroVase designed to help turn the circulation problem around. And here to show us how it works is podiatrist Dr. Pedram Hendizadeh. Dr. Hendizadeh comes to us from Associated Podiatrists of Fairfield, and he's joined by patient John Condon. Thanks for being here.
Thank you for having us.
And I should point out that this is the first time that John is getting this treatment, so we get your actual reaction first time out. You're a guinea pig for us. Is that okay?
It sure is.
Go ahead and show us how it works.
Well, basically the way the machine works is it allows for electric stimulation to the patient's muscles.
Okay.
And this is a biphasic system. It's a patented system which allows electric current to go through these pads. We usually have them up on the thighs, the calf, ankle, and the foot.
Okay.
And allows for muscle contraction. As I turn this up, John's muscles will start contracting. And as they contract, it allows for blood flow down to the foot. Patients with diabetes, patients with poor circulation would benefit from this because it helps improve circulation, helps bring nutrients and oxygen back into the tissues.
Oh, that makes sense. John, what are you feeling as it goes?
Okay, as he turns it up, right now I'm not feeling anything, but he'll turn it up a little.
Probably.
Ah, there it is.
Ooh,
There you
I
can
saw
see his
your-
muscles contracting.
Yeah.
And that just tingles.
It doesn't hurt.
No.
And doctor, is this like actually, would it be the same if he was out at a gym working out with these muscles?
It's similar to that. This is meant for more patients that are not ambulatory, they can't walk that far, patients that are with walkers, with crutches, they can't walk more than 100, 200 yards without having pain. So this helps improve the circulation without having to get up and walk.
And that is the key, getting that blood moving.
Right.
Tell us about, it's not just diabetes where people run into circulation issues, is it?
No. Patients with high cholesterol, smokers, patients that just have poor circulation just from genetics.
And we have some signs that you gave us of poor circulation people can keep an eye out for. If their feet are cold all the time?
Right. A lot of patients with poor circulation are not getting enough temperature, heat. The body's response to that is to help increase circulation, but they can't because their blood vessels are thinned out.
Okay, but if people have cold feet often, they shouldn't panic. There are other signs to combine, like the wounds that won't heal.
Correct.
And, you know, how soon should a wound heal before you're worried?
Depending on the size of the wound, if it's just a cut or a scrape, it should be a few days. If it's a larger cut, it may take a week. If it takes longer than a week, you should certainly contact your physician, podiatrist.
And tell us more about how this is working, how you know it's helping the patient.
It's more patient feedback. The patients usually get 2 to 3 treatments a week. The treatments last about 40 to 45 minutes. They tell us after the 3rd or 4th session that they're feeling less pain, better circulation. A lot of the swelling goes down because the muscles are pumping and it gets rid of that edema. The circulatory system is a closed system, and blood is just continually going from the heart to the feet, back up through the veins. And if there's blockages, it's like a traffic jam, on I-95. Everything's slowed down. What this does is increase the speed of the blood flow.
Okay.
The quicker the things move, the more oxygen and nutrients we can get down to the foot.
So it's pushing the blood through. And are you sending currents individually, or is it all at once going up?
It is individual in different locations, but it is simultaneous.
So if you send one to his foot, will the muscles down there contract separately?
They're contracting as well, yes.
And that's going on right now?
Right.
That
A
is.
lot of it you can't even see. It's only the heavy, when you turn it way up, that the contractions are quite visible to us.
Right.
Oh, that's interesting. I would imagine it feels kind of good.
It does.
Is it like almost like a massage of some sort?
Like that, it's like a rapid massage that pulses on and off.
You know, this strikes me as similar to what they put on me in the hospital after I had my baby to avoid blood clots in my legs.
Right.
Is it?
That's a device that basically inflates to prevent blood clots.
Right. Is that moving the blood similarly?
That is moving the blood similarly. This gets in deeper, though. This gets into the deep tissues. That's more on the surface.
Oh, I see. So this is much more deep, working deeper.
Correct.
And what is the biggest problem with diabetes patients in terms of circulation? Are they not managing it well?
We have a lot of different problems. You know, diabetic patients that are smokers, they're not taking care of their feet, they're not exercising, their blood sugars are running high. I mean, there's a vast majority of problems they can run into.
Can this stop the progression of poor circulation?
Absolutely. It'll help improve circulation as long as you're using the device.
Right.
And the effects last up to 6 months to a year. But
So if it's helping, keep in mind you'll probably have to continue forever.
Right.
But just not necessarily as often. Is that how it works?
Correct. The patients will come in for 3-4 weeks. They'll feel better. 6 months, a year down the road, we'll reevaluate them, and they might need another session.
That's fantastic. Thank you so much.
It's a great device.
Yeah, it's MicroVase, and we have more details about it on news12.com. We actually have a link to the company. Thanks so much. Next on 12 on Health, help for your heart before it's too late. How one local hospital is hard set on getting patients life-saving treatment faster than before. You're watching 12 on Health. Now, Vice President Dick Cheney's recent blood clot has raised awareness about how important it is for heart problems to get treated quickly. And one local hospital is taking steps to make sure they don't miss a beat. Danbury Hospital boasts that it has one of the best door-to-balloon times. And that's the time between a person experiencing a heart-related symptom and receiving treatment. Here to explain is Dr. Hal Wasserman. And Dr. Wasserman, the Director of Interventional Cardiology